So moving to the next question, the stylohyoid muscle it is supplied by. So the stylohyoid muscle it is supplied by a branch of the facial nerve. So this one is the stylohyoid muscle. So it has origin. The origin is at the styloid process. So it originates from the styloid process of the temporal bone. Think of styloid process like a tiny finger-shaped bone structure that hangs down from the base of your skull. Insertion, the muscle it is inserted into the body of hyoid bone. So this one is the hyoid bone. It is inserted on the junction of the body and greater cornu of the hyoid bone. The stylohyoid muscle it is supplied by a branch of the facial nerve. So the nerve is just like an electric wire that sends the signal from your brain to the muscle, telling it when to contract and when to relax. What is the muscle action of this stylohyoid muscle? So when the stylohyoid muscle, so this muscle would contract, it would produce following functions. It would produce elevation of this bone, that is hyoid bone. Hyoid bone. So imagine you are about to swallow a big bite of your favorite food. So your stylohyoid muscle that would help to lift the hyoid bone upward. It is just like an elevator that carries the hyoid bone upward, that helps in the swallowing process. It helps in speech. When you speak, especially during certain sounds like Y, SH, the stylohyoid muscle it plays a role in controlling the position of the hyoid bone, and it is important for articulating the sound. Similarly, as you enjoy a delicious sandwich, as you take the bite and start to swallow, your brain will send signal through the facial nerve, stylohyoid branch, to contract the stylohyoid muscle. So that will pull the hyoid bone upward, helping to move the food safely during, helping to move the food safely down your throat. So that is how the stylohyoid muscle will act. So it is supplied by, well, your answer, it is supplied by the facial nerve. Let us move to the other options. The mylohyoid nerve, it is not a well recognized. The mylohyoid muscle, that is muscle of the floor of the mouth. It is innervated by mylohyoid branch of the inferior alveolar nerve, that is the branch of the mandibular nerve. The maxillary nerve, it is branch of the trigeminal nerve and provides sensory innervation to the upper jaw. The first cervical vertebra is not your answer. The answer is facial nerve. Moving to the next question. So let us discuss the suprahyoid muscles, their origin, insertion and nerve supply. That's very important for your entrance exam point of view. The digastric muscle, it has origin from the digastric fossa, and it is inserted into the intermediate tendon of the digastric that is attached to the hyoid bone. Nerve supply is by mylohyoid nerve. The posterior belly, the origin is from mastoid notch, and nerve supply is through facial nerve. The geniohyoid muscle, origin is internal mental spine of the symphysis, insertion again into the hyoid bone, and nerve supply is through C1 via the hypoglossal nerve. So remember the suprahyoid muscles. Which are suprahyoid muscles? Digastric, geniohyoid, stylohyoid, mylohyoid. Whereas the infrahyoid muscles, they are the sternohyoid, sternothyroid, thyrohyoid, omohyoid. So many a times the origin, insertion and nerve supply. That's the examiner favorite questions. So the infraorbital muscles, they are supplied by ansa cervicalis. The sternohyoid muscle origin is from posterior surface of manubrium sterni and insertion into the medial part of lower border of the hyoid bone. So remember the origin, insertion, nerve supply, that's very important for your exam point of view. Similarly, from let us discuss the posterior belly of digastric. It has an origin from. Just before we have discussed that there are two bellies. One is the anterior belly of digastric and other is posterior belly of digastric. So just before we discuss that, the anterior belly origin is digastric fossa of mandible and the posterior belly origin is from mastoid notch. So let us see in the figure. The anterior belly is supplied by mylohyoid nerve and posterior belly is supplied by the facial nerve. So these are the two bellies. The anterior belly, it has an origin from digastric fossa of the mandible. So this attachment, it helps in depressing the mandible and opening the mouth. Whereas the posterior belly, it has origin from the mastoid notch of the temporal bone. Remember, the posterior belly of digastric, it is innervated by a branch of which nerve? It's the facial nerve. The posterior belly, it has a origin from mastoid notch. So imagine this at starting point on the bony ridge just behind your ear. And it is inserted into the intermediate tendon which is connected to the body of hyoid bone. Think of this tendon as a rope that attaches the muscle to the hyoid bone. The posterior belly of digastric, it is innervated by a branch of facial nerve. So when the posterior belly, it will contract, it helps to open the mouth by depressing the mandible. So it's like the muscle job when you want to take a big bite of your favorite sandwich. Whereas the anterior belly, it originates from the digastric fossa and it is inserted to the same intermediate tendon connected to the body of the hyoid bone. The nerve supply is remember the anterior belly of digastric, it is supplied by the mylohyoid nerve. So like you are having a delicious burger. When you take a bite, the anterior belly of digastric will help you to close the jaw by lifting your lower jaw. So when it's time to open your mouth wide to take another bite, the posterior belly comes into play, depressing your lower jaw. So together these two bellies of digastric muscles work like a team, allowing you to enjoy your meal by smoothly controlling the movement of your lower jaw. So with these two bellies that helps to open and close your mouth while eating and speaking. Moving to the next question, which of following muscles retract the protruded mandible? Well, it's the temporalis muscle. This temporalis muscle, it is a powerful muscle. The posterior fibers of temporalis, they are responsible for retracting the protruded tongue. So they will help to pull the lower jaw back toward its resting position. So the temporal muscle, Temporalis muscle, it originates from the temporal fossa, that is the concave region on side of your head, and it is inserted into the coronoid process. So it's the end point where the muscle will connect to the jawbone. So the temporalis, it is supplied primarily by the deep temporal nerves, that are the branches of the trigeminal nerve. So what are the action of temporalis muscle? Then the first is the elevation of mandible. And other is retract the protruded mandible. So it helps in closing the jaw by elevating the mandible. And it also helps in retracting the mandible, that it helps to pull the jawbone backward. The anterior belly of digastric, it is supplied by, the anterior belly of digastric, it is supplied by mylohyoid, and the posterior belly, it is supplied by the facial nerve. The middle meningeal artery, it enters the cranium through foramen spinosum. So the foramen spinosum, it transmits the middle meningeal artery, meningeal branch of the mandibular nerve, that is the nervus spinosus, and posterior trunk of the middle meningeal vein. So let us talk about the pathway of this middle meningeal artery. So imagine the artery as a traveler on the road map. So in the beginning, it will goes upward and inward, passing deep under the muscle, that is the lateral pterygoid. And over the you can remember the lateral pterygoid as a bridge, and over there is a ligament, that is sphenomandibular ligament. Imagine it as a road sign. After that, it will enter the castle. So our traveler need to enter a castle, that is your skull, to continue the journey. So to do this, it goes through a special gate that is known as foramen spinosum. So think of this gate as a secret passage leading into the castle anterior. So once it enters, the artery goes on an adventure within the castle walls, that is your skull. So it's important to know that there are other small roads nearby, but the artery stays a bit closer to the outer wall, and it divides into two separate branches, the anterior branch and the posterior branch. One is the frontal branch, that is the anterior branch, and the posterior branch is the parietal. So it crosses a point that is known as pterium. So this one here, it is pterium. So think of this as a crossroad. After that, it moves upward and backward. Along with that, it comes close to an important area, that is the motor area of the brain, that will control the movement. The other branch is the parietal branch. This one is the parietal branch. It goes backward, following a groove in the brain surface, and it ends in the front of specific part of the parietal bone, and it splits into the smaller rods. So understanding the middle meningeal artery path and its relation with important structures of brain is crucial for surgeons. So in case of emergency, they need to know where this artery is and how to handle it carefully in order to prevent bleeding around the brain that can be even life-threatening. So your answer, the middle meningeal artery, uh, the answer is C. It enters into the cranium through the foramen spinosum, as we have discussed. Let us move to the next question. Which of following muscle is inserted into the pterygoid fovea? So this region is the pterygoid fovea. It's the lateral pterygoid. So the lateral pterygoid, let us discuss that. Imagine you are a builder constructing a bridge. That is your job. And that needs a strong cables. The cables are the muscles that are required to, to let your jaw work properly. Now there are two heads of this muscle, lateral pterygoid. One is the upper head and other, this one is the upper head and other is the lower head. So this one is your lower head. So a lateral pterygoid, it is a superhero with two heads. We have upper head and other is lower head. The upper head, it starts its journey from the top part of the grand castle, especially the which bone? Sphenoid bone. Whereas the lower head, it begins from side of tower within the castle. That is the lateral pterygoid plate. Now both these heads, they are on a mission. They run backward and bit to side like two cables joining forces heading toward the jaw. So these cables come together to form a strong attachment point that is known as pterygoid fovea on the front of your jaw. So the muscle insertion is in the pterygoid fovea. So think of this pterygoid fovea as a hook on the jawbone. So the lateral pterygoid muscle mission is to pull on this hook. So when it contracts, it will help to open your jaw, move your jaw, and play a role in chewing. So just like a superhero that is receiving orders, the lateral pterygoid muscle get its instruction from special branch of the mandibular nerve. So when it contracts, it helps you to open and close your mouth. Allowing you to enjoy meals, speak, and express yourself. The sensory nerve supply of the parotid gland, well, the sensory nerve supply of parotid gland is through auriculotemporal nerve, this nerve. Now the the parotid gland, it receives nerve supply through parasympathetic nerves, sympathetic nerves, and sensory nerves. Now the parasympathetic nerves, they are the secret agents. So think of these nerves as a start button for your parotid gland for the parotid juice production. So when you eat, your brain will send signal to these nerves to tell the gland to release saliva. Whereas the sympathetic nerves, these are like traffic controllers. For the blood vessels around your parotid gland. They will regulate the blood flow to ensure that the parotid gland, it gets right amount of oxygen or the nutrients. It's like making sure the factory that is the parotid gland, it gets the proper resources. It needs to work properly. Whereas the sensory nerves, they are like watchdogs. They will keep an eye on the surrounding of your parotid gland. If something is unusual or potential harmful happens in that area, these nerves will send signal to your brain to alert you. That helps you to stay away from uh, what's going around your gland and in your head and neck. So the parasympathetic nerve starts saliva production. The sympathetic nerves will control the blood flow, and the sensory nerves will watch out for anything unusual. So the parasympathetic nerves, they are just like a secret agents. They start their journey from a special place, that is inferior salivatory nucleus. So they in their journey they take a ride from the various nerves highways like the glossopharyngeal nerve, tympanic plexus, and finally the lesser petrosal. As similar, you are changing trains. So once they reach the otic ganglion, this otic ganglion, they meet up with other agents for briefing. After briefing, the agent continue their mission by hitching and ride on this auriculotemporal nerve that acts like a secret agent car. So they finally reach to the parotid gland where they tell it to start producing saliva. Moving to the next question, the platysma it is supplied by. Well, the platysma it is supplied by the cervical branch of the facial nerve. So platysma, remember, it is a thin sheet of tissue that wraps around your skin like a superhero cap. So it is supplied by think of the facial nerve as the commander of your face muscle. So when you want to show emotion on your face like surprise or stern look, the facial nerve will send signal to different muscles including the platysma. So the facial nerve tell the platysma to slightly tightens, making your neck look bit tense. So that is its action. So which of following structure is absent on face? It's the deep fascia. Deep fascia, it is generally absent over the face. The ansa cervicalis supplies all of the following muscles except the term ansa cervicalis, it refers to a nerve loop or loop like structure in the neck, in the cervical region. So it is formed, it has the ansa cervicalis has two nerve branches. One is the superior root and other is the inferior root. The superior root, it is formed by ventral rami of C1 nerve, whereas the inferior root, it is formed by C2 and C3, second and third cervical nerves. So these two roots, they will unite to form ansa cervicalis, so which gives off branches to supply various muscles in the neck. So the ansa cervicalis primarily innervates the muscles such as infrahyoid muscles. They are sternohyoid, sternothyroid, and inferior belly of omohyoid. The genioid muscle, it is supplied by the separate branch from the first cervical nerve through the hypoglossal nerve. So genioid and thyroid, they are supplied through hypoglossal nerve through C1. Absence of which of following muscle causes underdevelopment of mastoid process? Well, the absence of sternocleidomastoid muscle, it can lead to underdevelopment of the mastoid process. So your answer is A. The air sinuses which can be used as skeleton maturity index, they are the frontal sinus. So frontal sinus, it can be used as skeleton maturity index. Lymphatic from the lips drain into which of following structures? So answer is B. So remember the face has three lymphatic territories. This one, region A, B and region C. The region A is the upper territory that includes the greater part of forehead, lateral half of eyelid, conjunctiva, lateral part of cheek and parotid gland that drains into the preauricular nodes. The middle territory, this B region, it includes the frontal strip of forehead, external nose, upper lip, lateral part of the lower lip, medial half of the eyelid, that drains into the submandibular nodes. The third area is, this one is the lower territory. That is the central part of lower lip and chin, they drain into the submental nodes. So this figure is very important for your entrance exam point of view, very well given in BD Chorasiya. The temporal, zygomatic, buccal, mandibular and cervical branch of facial nerve. So they are the terminal branches within the parotid gland. So temporal, zygomatic, buccal, maxillary, cervical, they are the terminal branches within the parotid gland. Maxillary sinus, it opens into the maxillary sinus. So the opening of the maxillary sinus, there is a region that is known as hiatus semilunaris. This region is hiatus semilunaris. In the middle meters, there is elevation, that is bulla ethmoid. So this one is bulla ethmoid, and below it there is hiatus semilunaris. And anterior to hiatus semilunaris is where the the frontal sinus open. The posterior to hiatus semilunaris, there is opening of maxillary sinus, and superior is opening is superior to this hiatus semilunaris, middle ethmoid sinus opening is there. So answer is posterior to the hiatus semilunaris in the middle meters. The sensory nerve supply of capsule of TMJ is by which of following nerve? It's by the auriculotemporal nerve. The mesenteric sling, it is composed of masseter, and the mesenteric sling, it is a powerful pair of muscle that wraps underneath the angle and the ramus of mandible. So on the lateral surface of mandible we find the masseter, and on medial surface we find the medial pterygoid. So the mesenteric sling it will compose of masseter and medial pterygoid. The most common type of synostosis is that of the sagittal suture. So most common type of cranial suture fusion is the sagittal suture. The branch of the facial nerve that leaves the submandibular gland run forward anteriorly over the mylohyoid and branches into deep and superficial branches. It's the submental artery. The middle territory of face it drains into the submandibular lymph node. Already discussed. This question was we have already discussed. The foramen magnum transmits following structure through the wider posterior region. So through the wider posterior region, the structure passing are the lower part of medulla oblongata and 3 meninges. So answer is, and from the narrow anterior part, the structures they are passing are the apical ligament of Dens, cruciate ligament, membrane tectoria. Through the subarachnoid space, the structure passing are the spinal accessory nerve, vertebral nerves, sympathetic plexus around the vertebral arteries. So the premature fusion of coronal suture along with the basal suture show which of following features? The answer is oxycephaly. So oxycephaly it is also known as, remember, tetracephaly. So where the multiple sutures in skull they fuse prematurely, that can lead to tower shape head. It involves the fusion of both the sagittal and the coronal sutures. The trigonocephaly it involves the premature fusion of the metopic suture. So that creates a triangular shape at the front of skull that gives a pointed appearance of forehead. The brachycephaly it is due to the premature fusion of the coronal suture. So that fusion can lead into skull that is short from front to back, and that gives a flattened appearance at the back of head. The scaphocephaly means it is dolichocephaly. So that leads to narrow skull or boat-shaped skull. So where the sagittal suture that runs along the top of skull it fuses prematurely. How many fontanelles they are present at birth? 6 fontanelles they are present. Anterior fontanelle, posterior fontanelle. There are 2 anterolateral fontanelles and 2 posterolateral fontanelles. A total of 6 fontanelles. The middle meningeal artery, it is associated with spinosum. Which of following structure passes through the inferior orbital fissure? It's the infraorbital nerve. Which of following ligament, it is not a ligament of TMJ? The answer is pterygomandibular.